Welcome back. Drug abuse is a problem that is causing serious concerns to both individuals and the government all over the world. The problem is prevalent among adolescents, who in most cases are ignorant about the dangers inherent in drug abuse. Many of them engage in these acts out of frustration, poverty, lack of parental supervision, peer influence, and pleasure. However, with effective counseling programs, these societal problems can be tackled. This is the thrust of our Dateline this week. Stay with us.
The consumption of hard drugs in amounts and ways not authorized by medical professionals has become but a silent reality that Nigerians should worry about. Although drug abuse cuts across all strata, powerful statistics make it abundantly clear that the youth, mostly males, with a sprinkle of females, are the real culprits.
Abuse of narcotics has incapacitated the workforce of organizations and is destroying our communities and our society. It has brought about family disintegration, decimated the capacities of our youth, and given rise to all types of crimes such as insurgency, terrorism, banditry, kidnapping, rape, and violent extremism, which have befallen nations, including our dear country Nigeria, with attendant health consequences on the users.
Studies have shown that there are three main forms of drug abuse. They include the use of mood-altering or psychoactive drugs, performance-enhancing drugs, and dependency drugs. While mood-altering or psychoactive drugs such as codeine and tramadol affects the user's ability to reason and gives him a false sense of well-being, performance-enhancing drugs such as cocaine and heroin gives him extra stamina or energy. Dependency on drugs typify the kind of drugs that people abuse in the course of trying to overcome health issues or challenges, or taken to maintain a particular lifestyle. This stunning awareness has made getting to the root of the social challenge more compelling.
Codeine has no place in cough therapy. So we can do without codeine. In fact, most hospitals don't treat cough syrup with codeine. Usually you don't see it on prescriptions. Even before the ban, you don't see it on prescriptions because it doesn't really give you much. If you treat a patient with cough syrup with codeine, it keeps coming back.
You find that Nigeria has been a transit route for illicit substances, and because of that, for substances that cannot find their way out or through the country or find their way into the country are likely going to be abused within the country.
Apart from the negative peer influence, unemployment, anxiety, and a continuous need to run away from problems are the major reason why Nigerian youths take to drugs. This, however, may not be the only explanations fueling this social evil. Specifically, the desire by these youths to hide their weaknesses, failure on the part of parents to raise overall healthy children, the broken home syndrome, and pressure to succeed at all costs also promotes drug abuse among youth. It has been proven that drug consumption in amounts and methods not authorized by medical professionals has in the past led to mental disorder. It has also disrupted the user's education and future, led to poor attitude to work, and caused health problems such as lung disease, heart disease, and death, among others.
From some of the research findings that we have seen, and from the experiences working through communities and everywhere, we can see that we have a growing drug problem, and many young people are getting involved. Even considering some of the national research work that has been done, talking about the integrated biological behavioral surveillance survey, most of the injecting drug users they were interviewed were reportedly to be young people.
Presently, and when I say presently, I need always to be careful because the last drug use survey dates now back to 2018, and of course 3 years have passed by in the meanwhile. But at that time, the prevalence was most expressed in the age bracket between 25 and 39 years old. I expect that this is going to probably get increasingly younger, and then we're going to see more and more users also of a younger age.
It is no doubt a socio-economic problem that requires a prompt solution. The Social Development Index showed that the development of young people has gradually deteriorated in the past decade. These adolescent issues and problems should therefore provide useful pointers for designing the Positive Youth Development Program to be judiciously sponsored by government or its reliable developmental partners. The federal government and its agencies must come up with strategies that will effectively tackle the challenge from its roots. Before now, what government is doing in this direction is but a palliative measure which can only provide temporary relief while leaving the disease and its ravages unaffected. To succeed in this task, therefore, government must evolve workable strategies towards creating jobs for qualified youth, addressing the challenges facing the education sector in terms of funding and tackling the infrastructural challenges.
Whatever government does to interdict and punish those who peddle and traffic in drugs, I think everybody should go for that. But I always urge government that those who use are victims of a problem and they need help, and we should try to help them.
Reorientation of the youth on cultural values by faith-based organizations and civil society groups will assist them to quit the consumption of illicit drugs and the unwholesome behavior that endanger their lives and threaten the society. Parents and guardians must strive to monitor their children at all times and be aware of the kind of friends their children keep, as well as the places to go to. Unfortunately, many young people derive their identity from their peer group and their extensive social network. Youths, on their part, must recognize that the future is full of promises as it is fraught with uncertainty. They should therefore develop the capacity to seek activities laced with highest values. After all, drug addiction, misuse, or abuse have never helped anybody.